Juxta-Fit standard leggings are available in the Premium and the Essentials line of garments. Both of these product lines serve the same purpose and are equally as effective. However, the Essentials line features a 6-month warranty compared to the Premium line's 1-year warranty. The Essentials line offers an economical alternative to the original Premium line. Juxta-Fit standard leggings are designed for the treatment and maintenance of lymphedema and severe venous insufficiency and are an easier alternative to bandaging and compression stockings. These inelastic wraps are made of sturdy yet breathable material and consists of multiple instantly adjustable juxtaposed bands that are secured around the lower leg with Velcro closures. The open band design makes these leggings easy to apply, remove, and adjust throughout the day as needed. The Premium package includes 1 Juxta-Fit Premium legging, 1 pair of Comfort compression anklets, 1 pair of Comfort silver leg liners, and 1 set of directions for use. The Essentials package includes 1 Juxta-Fit Essentials legging, 1 pair of Comfort compression anklets, 1 pair of Comfort leg liners, and 1 set of directions for use. Optional package configurations may also include 1 Comfort Easy Single Band Ankle Foot Wrap and 1 pair of Comfort Silver Knee-High Socks or 1 pair of Comfort Knee-High Socks. The following steps will demonstrate how to properly measure for a Juxta-Fit standard legging. You will need a measuring tape in centimeters. Cirque disposable measuring tapes containing specific product sizing guides are available. Please contact us for more information on how to order these tapes. The Juxta-Fit standard legging is available in 2 lengths, a short 28 cm length and a long 36 cm length. The legging is available in sizes ranging from small to double extra large. To determine which legging length is appropriate for the patient, take the patient's medial ankle bone to knee crease length measurements in centimeters. The patient should be standing when taking this measurement. Be sure to take the linear measurement and not the contour measurement of the limb. If the patient measures less than 36 centimeters in length, choose the short legging length. If the patient measures greater than 36 centimeters in length, choose the long legging length. For larger limbs, it is recommended the long legging length be chosen, as girth consumes some of the length of the legging. Measure the patient's limb circumference, 5 centimeters, 15 centimeters, and 25 centimeters above the ankle bone. Locate the patient's 5 centimeter circumference measurement in one of the ranges in the column marked B on the sizing chart. Circle the range. If the measurement fits into 2 ranges, circle both ranges. Next, locate the patient's 15 centimeter circumference measurement in one of the ranges on the sizing chart marked B1. Circle the range or ranges that reflect the patient's measurement. Finally, locate the patient's 25 centimeter circumference measurement in one of the ranges on the sizing chart marked C. Circle the range or ranges that reflect the measurement. Choose the legging size for which the circled range matches are all within the same size. If the patient fits into 2 sizes, choose the size according to the patient's stage in treatment. If the patient's limb is expected to reduce significantly, choose the smaller of the 2 sizes. If there is little edema present, choose the larger of the 2 sizes. If the patient's circumference measurements do not fall within any one size category, a custom-made Juxta-Fit garment will need to be ordered. Please refer to this DVD's Juxta-Fit custom leggings section for more information. The following steps will demonstrate how to properly apply the Juxta-Fit standard legging. Don the enclosed footless liner first. The cupped edge of the liner should be near the foot and the liner should be pulled over the knee and should cover the ankle bone. Slide the Comfort compression anklet onto the foot and over the bottom part of the liner. Ensure that the anklet is pulled high enough above the ankle bone so that it will overlap with the legging. Also ensure that there are no wrinkles in the liner where it is tucked into the anklet. If using a Comfort Easy Single Band Ankle Foot Wrap or a Juxta-Fit Ankle Foot Wrap, Apply it prior to donning the legging per the directions for use. The foot wraps may be worn in conjunction with the anklet if desired. Lay the garment out flat with the band's hook tabs folded back onto the body of the garment. Position the garment with the black side of the material facing the skin and with the center seam running along the back of the leg. The bottom edge of the garment, identified by the circade label, should be just above the prominent points of the ankle bone. Disengage the top two bands, pull them above and below each other across the front of the leg, and loosely secure them to the outside of the legging to anchor the legging in place. Do not tuck the bands under the legging. The Velcro hook should never touch the skin or liner. Once secure, disengage the bottom two bands, pull them above and below each other to firm and comfortable compression, and attach the bottom band to the outside of the legging, overlapping with the anklet. The bottommost band can be identified by the circade label. If using the premium legging, the hook tabs may be secured to the respective woven loop sections on the outside of the garment. Before securing the second band, disengage the third band. While holding the second and third bands taut, pull the second band to firm and comfortable compression and secure it to the outside of the legging. Angle each band individually to achieve a snug and wrinkle-free fit. Continue this method of disengaging the following band before securing the band below it, going up the leg. Pull each band to a firm and comfortable compression level before securing it. Also, adjust the top two bands to firm and comfortable compression. Pay close attention to ensure that the bands are attached in alternating order and that they are being placed into the opposing gaps. The garment should lay flat against the leg. The bands may need to be pulled at different angles to make the garment contour perfectly against the leg. For Juxta-Fit premium leggings, ensure that there is contact between the hook tabs and the woven loop patches to extend the life of the garment. Note, however, that the hook tabs do not need to be perfectly aligned with the loop patches. Once all of the bands are secured, inspect the garment for any gaps, creases, or folds, and adjust the bands as necessary. If gaps are still present, return to the bottom of the garment and readjust each band accordingly. Once the legging has been appropriately donned, roll the top part of the sock liner over the top edge of the legging. Readjust the bands of the legging as needed throughout the day to provide firm and comfortable compression. Slightly loosen the bands for nighttime wear. The comfort compression anklet may be worn day and night, but it is recommended that it be removed if experiencing discomfort when lying down. If sensitivity to the anklet's cuffed edge underneath the legging is a concern, pull the anklet over the bottom of the legging once the legging has been donned. The Juxta-Fit legging should never hurt. It should feel firm and comfortable. If pressure increases or decreases noticeably during wear, loosen or tighten the bands accordingly. If experiencing any pain, remove the legging immediately and consult a physician. To remove the Juxta-Fit legging, disengage each band starting at the top of the garment and fold each band back onto the body of the garment. Do not tightly roll the bands back onto themselves, as this will cause the hook material to bend, reducing its adherence strength. Securing the hook tabs while not in use will aid in keeping them lint-free, thus extending the life of the product. When complete, the garment should resemble its starting position for easy reapplication. Slide the Comfort Compression anklet off the foot. If using a Comfort Easy Single Band ankle foot wrap or a Juxta-Fit ankle foot wrap, follow the ankle foot wrap's directions for use for removal. Lastly, slide the sock liner off the leg. To extend the life of the Juxta-Fit legging, hand wash and drip or flat dry the garment. It should not be bleached, ironed, or dry cleaned. The legging can also be machine washed in warm water using a gentle cycle and dried on a low heat setting. If doing so, it is recommended that the legging be placed in a pillowcase to keep the hook material lint-free and to prevent possible damage to other garments. Should lint collect on the tabs, it can be removed with tweezers. The anklets and sock liners can also be machine washed and dried. The following tips will help you achieve the perfect fit for the Juxta-Fit standard legging. For patients who have trouble seeing their lower leg, we recommend donning the legging in front of a mirror to ease the donning process. If the patient's measurements fit into a double extra large Juxta-Fit legging on the sizing chart, we recommend ordering a custom lower leg garment instead. Generally, as legs approach this size range, the limb shape is more likely to differ from what the standard garment design can accommodate. Limbs of this size will benefit significantly more from a garment that is custom-made to its exact shape. The Juxta-Fit standard legging should fit snugly and smoothly around the limb. If the hook tabs barely reach around the patient's limb or make contact with the patient's skin or liner, a larger legging size needs to be chosen. If the points at which the bands meet the body of the garment make contact at the front of the leg and a noticeable bulge is formed, a smaller legging size needs to be chosen. The loop patches that are sewn onto the outside of the premium Juxta-Fit legging are designed to prolong the life of the garment. The extra layer of material adds to the garment's durability. Their locations are based on estimations of where the hook tabs may be secured, but should not discourage the patient from securing the hook tabs where it feels most comfortable and provides the best fit. Shelf straps may be ordered with the Juxta-Fit legging to address problem areas that may not be sufficiently coverable with the legging alone. Shelf straps are traditionally used to support lobules, but can also be used to cover any gaps that may appear between the bands of the legging. Please be sure to indicate whether additional shelf straps are desired with the order. For patients experiencing discomfort along the shin when wearing the Juxta-Fit legging, we recommend using the Comfort Cotton Terry Knee-High Sock, which is the thickest and most padded liner we offer. If the patient experiences sliding issues when wearing the legging, consider using the disposable Comfort Non-Slip Liner, a tacky material that is worn directly against the skin underneath the legging. To use the non-slip liner, lay the sheet flat on a clean surface. Place the garment on top of the sheet with the hook tabs facing up. Cut the non-slip liner to the approximate size of the garment. Wrap the sheet of non-slip material around the leg where the garment will be donned, overlapping the liner to hold it in place. Apply the garment directly over the non-slip liner, ensuring that the hook tabs do not make contact with the liner. Patients have also had success with using smaller strips of the non-slip material and only partially covering the leg. A comfort cover-up for the lower leg may also be worn to create a sleek and refined appearance while helping extend the life of the legging. The cover-up protects the legging from wear and tear, keeps the bands attached in their proper position, and prevents lint collection on the legging's hook tabs. The cover-up also protects clothing and skin from getting scratched or damaged when rubbing against the outside of the legging. If the patient is looking for additional support above the knee, consider using the Comfort Capri in conjunction with this lower legging. The Comfort Capri is easily applied, overlaps with the legging, and offers mild compression from below the knee through the waist. If you or your patients have a specific request or custom alteration, we would love to hear from you. Most times these can be done free of charge, but may include an additional alteration fee, depending on the complexity of the request. Please contact us for more details.